can imagine a student coming to the David Geffen School of Medicine, already knowing about the strength of our programs, but seeing a building like this, thinking, I could be doing my medical school education there. I could be part of this community. I could be part of these exciting new ways to learn.
This is a modern medical education building, so it's not the way I went to school. Sit in a lecture, memorize, take a test. Not that way at all. This is interactive. We envision having nurses, dentists, public health faculty, graduate students, and our medical students all here together. That's how we take care of patients. That's how we do research. That's how we should teach students to learn.
By their nature, students love technology, and that coupled with brand new learning spaces has really fostered their learning.
The Learning Studio is one of the largest teaching spaces in our new building. It has the capacity for up to 400 people, and the flexible layout allows it to be used for a variety of different teaching activities, from instructor-guided presentations, breakout groups, team-based learning, and small group sessions. The tables are all movable and they have power at each seat, which is critically important for activities which require learners to bring in their own devices, such as our exams or team-based learning activities. Because the room is so large, microphones are essential. We've adopted the use of throwable microphones. People are excited to raise their hand and be the recipient or catch the microphone, and it has added an element of enthusiasm in some of our large group activities.
The teaching lab is a particularly innovative space for our teaching. We use it for multiple things such as team-based learning, as well as encouraging student interaction and sharing material. It's really a fascinating space that have really provided us a venue to experiment on new teaching methods that our students really appreciate.
The Geffen Hall Teaching Lab consists of 26 tables. Each table can accommodate up to 7 learners, which allows us to seat an entire class of 180 in a single session. At each table, we have one monitor. The left-hand monitor remains under local control, but the faculty member then can drive one source to the entire room on the right-hand monitor. A significant challenge in designing an AV system for a space such as this is audio. We designed a speaker that actually is embedded into the edge of the tables. The 7 learners at each table has their very own speaker directly in front of them. Through software, we can control the shape of the audio. They're going to be able to hear their local audio over and above all the audio nearby. One of the ways that the teaching lab is really different than a traditional lecture hall type environment that faculty tend to notice right off when they come in the room is that there is no front, there's no stage, there's no podium, there's no lectern, there's no real designated place where they are supposed to stand and give their lecture. The idea of a room like this is really to have the faculty members moving through the room and interacting with the students at their individual tables. That can lead to a real intimacy in the teaching. Even though we have a room full of 180 students, that faculty member at that moment is only talking to between 1 and 7 students at that particular table, so they have their attention, they have their focus.
The new teaching spaces at David Geffen School of Medicine is not only magnificent, but also innovative and transformative. And as a physician and a future patient of these future doctors, it inspires me and excites me to know that they learn in such an environment where it fosters not only learning, but also communication and collaboration among different professions.
This represents a significant leap forward in the technology available for teaching and learning here at the David Geffen School of Medicine. And for that, I am incredibly proud.